Yeah.
Amazing. Yeah. Okay. What do you do in Oakland?
I actually work in San Francisco still, and I do security for
Oh.
Securitas.
Who is it?
Securitas.
Securitas.
Mm-hmm.
Okay, cool. And you're transitioning.
Yes.
It's exciting. Awesome.
It is. It was wonderful. I'm just grateful because even with the process, I don't think I could have been present where I'm at today. I just started about the horses. I just got back from Life Cycle.
Oh, no worries.
So, and then, between that, being sober, between just everything, life has become amazing. And I'm just grateful to actually be doing this now versus trying as we started doing it a few years ago.
Got it. Yeah, really. Well, yeah, you're so young. It's really kind of a nice thing.
Mm-hmm.
Your neck is beautiful.
Oh, thank you.
Yeah. So, well, so I ask if you have questions.
I actually really don't have too many questions, so.
Okay, so you're interested in the bottom surgery?
Yes.
Anything else you want to be doing at the same time, or?
Currently, it's the only thing my insurance pays for.
Okay, that's something at least. Mm-hmm. Yeah. So, insurance, as you may know, is widely covering this as a regular health benefit. So, we're the first, still, and only place, I believe, that covers the surgery. Other places make you pay in full first, and then you get compensated, which works out the same. But it's nice when you don't have to pay out
anything out of pocket.
Pay out $20,000 to have this done. So, and that's why. But it takes a lot of work. So we have one full-time dedicated person to do just that. So all you have to do from your end is to get on our schedule. And assuming you meet all the criteria, so we still do follow some of those standards.
And I have all the letters, everything.
The point of any of those standards is not as a hoop to jump through, but to make sure that you're doing the right thing, and that you're not going to have regrets, and that your eyes are wide open when you go through the process.
Yeah.
So, so that's how it goes. Now, once you're on the schedule, then we are actually not allowed to pre-authorize benefits until we're within 3 months of surgery. So within 3 months, then Miss Janet, who's our insurance goddess, she gets on the phone and starts to fight for you, and she doesn't lose. Assuming it's a covered benefit, she'll get it covered. Yeah. Even sometimes when it's not a covered benefit, sometimes we've been able to make a case for why it should be a covered benefit. And generally, if these things go to court or go anywhere outside of, if they go to the insurance commissioner or anywhere else, they fall in our favor. Because it's generally improving people's quality of life. So that's what we would be all about. So that's good. Anyway. So surgery itself, if you just to know a little bit about that, we do it here at Mills Peninsula Hospital, which is part of Sutter Health. It's a brand new hospital, and it's the staff itself is wonderfully diverse. I mean, the employees in that hospital literally are from every country on earth. I mean, I can almost say that with certainty. Maybe not Iceland. No, I think there is some in there. Anyway, but there's a transgender nurse on the floor, and there's, about a third of the anesthesia staff is GLBT. Yeah, so the result of that is that it's just a very forward-thinking, welcoming place. It's really, you'll feel, it's not San Francisco exactly, but it's cool. And plus they're just very, very good at what they do. Does that make the process go through 100% perfect? No, but it gets us a long way. It's very, very good. And then, with the part that I do, you can really walk out of there in just 3 days and feel pretty good that you won't ever have to do anything again, just with just basic maintenance with dilation and taking care of yourself generally,
Mm-hmm.
the vagina at least is really pretty self-maintaining. So you should end up with something that looks very good, very realistic, very functional. Most everyone can orgasm. It's not 100%, but it's a high percentage, well in excess of 90%. Basically, the rule of thumb usually is if you were able to orgasm before surgery, you should be able to after surgery. You should be able to urinate like any other woman, which means a somewhat directed stream. It's messier as a woman anyway. And in the first, I would say even 6 months, it sometimes happens where it's a little messier for a while. But most of that straightens out. Sex is possible, penetration not, boys or toys, whatever you choose. Things are possible. You'll have a G-spot, which some people are calling the B-spot now, named after me. But in other words, the legendary B-spot, or G-spot, which is located along the front of the vagina, that you will have. Your clitoris should be sensitive. It comes from the head of the penis. Depth is excellent. I mean, we say, we always get depth, and it's usually true. About 6 inches or more is pretty much our gold standard. It's very unusual when that is not the case. And that's it. And then complications are relatively few. They amount mainly to issues with the incisions healing. So there can be some sometimes that incision will work its way apart slightly. Sometimes there's what's called granulation tissue. A hematoma is possible, which is a collection of blood beneath the skin. Those are very rare. The hematomas maybe 1 in 50. The other issues with the incisions maybe 1 in 12 total. And every patient gets our contact information afterwards. So I don't care if it's in 5 years, 10 years, 2 months. You call me or text me, and we'll deal with whatever it is. Now, having said that, you can hear this is my cell phone's been sitting here the whole time. We get a phone call back or a text or any contact from patients after surgery, even in the first week or 2, but ever. We only hear from about 1 patient in 10 ever again, which is really kind of surreal because, 1, I end up forgetting about you, and you forget about me, which is even better for you. But I mean, what it means is people end up going on with their lives, and they're generally happy with how things turn out. Anything that would not be good, we'd want to hear about it. And that's why our phones are always on. They're always here. You can send photos, faxes, texts, emails, whatever you need to. There is a chance you would need to come back for a second surgery if there was not something good cosmetically. And I tell everyone that too. Same thing. You need to come back. There is a charge for that. But historically, it was always done in 2 surgeries anyway. So that second surgery gives us a chance to touch things up, make it look just a little bit better. And yet, in almost 1,200 surgeries, we've had fewer than 50 people ever come back for a second surgery. So it's still just not very common that you need to come back. So that's pretty much it. That's kind of what happens. And you'll be given the dilators that you need to maintain depth.
How long do you use the dilators for?
Those are indefinite. Those are probably, especially they're important the first year after surgery. But, we still have people, it's still, even after a year, you'll need to do it occasionally. Yeah. So, yeah.
And so is it my understanding that it cut in 4s and tucked in?
Sorry?
Is my understanding is cut in 4s and tucked in, or how's it done?
That's some of those old techniques where they end up with a lot of incisions or just, cut in 4s, quartered up, you mean? Like kind of like a stick of butter?
Yep.
No, any of the stuff online is just awful, and how they The incisions are nasty, ugly. Ugh. You don't end up with something pretty.
So how's it done now?
We use the penile skin. There's no question, but we also use some of the scrotal skin, and we treat that as a full thickness skin graft, and then line some of that with that as well.
Okay.
So that's why we're able to get so much depth. We use every part of you. There's nothing goes to waste. A very small amount of erectile tissue is discarded, and the testicles are discarded. But other than that, we use everything.
Okay.
Yeah. So that's about it. Yeah. So complications are pretty. Yeah. And then major complications. The only one that is any worry is called a fistula, and frankly, that's in good hands. It should really never happen.
It sounds kinkier than probably it is.
Yeah, it can. I think in lesser known places, I can't say it's never happened to us, but frankly, I consider it one of those things that just should really never happen, except in the most dire of circumstances, really. Okay. So, yeah.
Yeah, I have all the letters from my doctors, from my psychiatrist, psychologist. And everybody's pushing it. They're pushing it quicker as soon as possible, so.
Good, yeah.
Yeah, I'm looking at the police academy, and I want to make sure it's done before next year's life cycle.
Yeah. You have still some hair to remove here, don't you?
Not much.
Not much, though. Yeah, it's getting pretty thin, but you probably want to do as much of that as you can before, because are you doing electrolysis or laser at this point?
I had laser, but there's very little that's done. There's just a couple.
Yeah, just a small little area. Yeah. So it's not much, but it's nice to have all that stuff out of the way before you end up coming here. Yeah. But you do it whatever way you want, It's great. You look great. So,
thank you.
Yeah. So, it's the problem now is having enough staff to do as many surgeries as we need to do. I do have another partner who's coming on, I've been working with for over a year now. And she's just about getting ready to get going. So, for people who are getting really desperate, I think eventually we'll have her, have them work with her, assuming they want to, this is definitely a surgery that's individual to the surgeon, but she's worked with literally every surgery I've done.
Yeah, I'm pretty confident with pretty much whoever the surgeon is working with your office.
Yeah. Well, we're going to be. As far as I'm concerned, I'm going to be your surgeon. But that's
perfect.
Yeah, I'm not turning anything over to any ever. I'm going to be doing this a long time.
Okay,
so
good.
It's not like that.
That'd be preferred, but
it's more for somebody who says, hey, I have to get in, and it has to be tomorrow. And if I just literally can't do it, then maybe that'll be who ends up starting to come to her. But anyway,
I won't be. And how long is pretty much the healing time?
The healing time? It's about 3 months. It's a fairly long recovery, but you can get back to work within 4 weeks usually. Okay. So
definitely sooner than later because life cycle is in June.
Oh, wow. Yeah. So you want to get in before that. Well, right now the waiting list is out over a year, but
because I was told it was the end of March.
You have a date already?
That's what you guys originally told me when I talked to you guys.
Sweet cakes.
Probably about a couple months ago when we were starting this.
And with you being close, see, people reschedule for all sorts of different reasons, whatever it is, Somebody gets sick or the dog dies or whatever.
Oh, no, there's no reschedule.
But with you being close, if you're on the waiting list to move up, you can do that.
Yeah, I definitely will like that because...
And if they know where you want to be exactly, we can usually work that into our schedule too, so...
Yeah, I would love sooner than later because we got the training for it. See, I rode last year. This year I was a roadie, and next year I'm riding again.
Okay, cool.
So I really need as much time as possible on the bike.
Okay.
So my doctor...
Bicycle riding normally takes about 3 months before you can get back to that.
My doctor would love it this year if we can because there's also cysts that are growing.
Okay.
And anything that we need to get rid of.
Got it.
That are uncomfortable.
Got it. Yeah. Okay. Sounds good to me. Okay. So, any other questions that you have?
No, nothing that I can think of. Let's see. So you're in the hospital for about how many days?
3 nights is
3 nights? Okay.
Yeah, 3 nights. And then you're 3 more nights in the area, which means you could actually go back to the East Bay.
Okay.
Nothing really exciting over the weekend happens. It's like watching paint peel.
Okay.
And then you come back, and then we do the dilating and the teaching on that following Monday or Tuesday usually.
And when, how intense is the pain usually?
Sorry?
And how intense is the pain usually in healing?
It's
the
shockingly
meds?
little.
Okay.
This hurts less than most any surgery I can think of.
Okay.
So maybe wisdom tooth out or something.
Okay, because a lot of people think it's like...
No, not. It hurts less than a breast augmentation. Hurts less than a nose job.
For real?
Ever happened. Yeah.
Wow.
And I can tell you a couple people recently just no. Minimal. It's actually shocking.
So what are the common pain pills usually people are on recovering from then?
Oh, usually Vicodin or Percocet.
I can't do Percocet, so...
Oh, we'll find something.
Okay. I can do morphine, I can do everything, I just can't do Percocet. It makes me hallucinate.
That's okay. We don't want no sense going into orbit.
Okay. Wow. Yeah, so hopefully we can get this in sooner than later, because I'm also trying to get into the police academies as well, so...
Well, are you definitely on the waiting list?
That's what they told me a few months ago when when my insurance approved it, so...
I mean, just check in with Janet and say, just see, or Robin, just see. She's not in today or tomorrow, I think. She's got a sick relative. So.
Who's the one at front?
Well, they actually work out of Colorado, my staff that schedules. So Michelle's here. She does all the local stuff, getting patients in and does the scheduling. Robin and Janet do the
okay. So yeah, I've talked to
coordination and the insurance, but they're out of Colorado. So.
Okay, so I need to contact Colorado.
Yeah.
Okay.
So that's kind of it. Yeah.
Perfect. Thank you.
Yes.
Thank you.
Fantastic.
Well, thank you.
You're welcome. Yeah, I'm looking forward to it. Yeah.
And